Myth. Doctors won't try as hard to save my life if they see I'm an organ donor. Fact. The first focus of any doctor is saving your life. Myth. They could sign my death certificate while I'm not actually dead. Fact. People who agree to donate organs undergo extra testing to determine they're truly dead. Myth. I couldn't have an open casket funeral if I donate my organs. Fact. There aren't any visible signs of organ or tissue donation. These myths have been dispelled by facts courtesy of the Mayo Clinic, so it's a wonder more people still haven't made the decision to register as donors. I myself made the decision to register as a donor when I got my driver's license at age 16, after I took into consideration the lives I could potentially save and did some quality research on the organ donation process. Thousands of people die every year waiting for a transplant, and despite the rise in awareness in registered donors in the United States, people across the country who have yet to register should seriously consider becoming a potential organ donor. Unfortunately, without more donors, patients waiting for transplants will continue to run out of time. Around 21 people die each day in the United States waiting for a transplant that they never receive, according to the U.S. Department of Health and Human Services. That means 21 people who could be someone's grandfather, brother, daughter, or wife lost their lives. 21 people who were hoping they would receive a donor organ. At one time, those 21 people were amongst the nearly 124,000 men, women, and children who are awaiting organ transplants, as reported by Donate Life America. Katie Capel's foundation estimates approximately 2,100 of those people are pediatric patients who have yet to have the chance to grow up and experience life. Some of them were living normal childhoods when their world was turned upside down, and some haven't even had childhoods outside of the hospital. These particular statistics represent the dire side of organ donation, but not all patients on the transplant list lose their lives. The 21 people who die every day, although devastating, is at least still outnumbered by the number of people who receive a transplant. The Department of Health and Human Services lists 79 as the average number of people who are the recipient of a donor organ on any given day. 79 lives are saved because a complete stranger made the decision to register as an organ donor. Those are people who could have lost out on the opportunity to grow old if they hadn't gotten a transplant. Despite the lives being saved, however, the gap in supply and demand continues to increase. There are simply not enough donors to save the lives of every patient in need of a transplant. The 120 million people who have signed up may seem like a large number, but when you consider that most of these people don't end up donating their organs, the reality of the number is apparent. So far, in 2015, the organs of 3,521 people have been donated. If you multiply that by 8, which is the number of lives that can be saved by one donor, you get 28,168. You can see how the current donors barely affected the approximately 124,000 people awaiting a transplant. As if that difference isn't drastic enough, every 10 minutes someone in the United States is added to the transplant waiting list. So the demand for organs is on the rise, while the supply is coming up short. This is a problem, but for every problem there is a solution. The likelihood of finding a donor match for a patient in need of a transplant is greater if the number of people on the donor list increases. Even though awareness of the issue has increased, Organize, a nonprofit striving to simplify the registration process, reports that 95% of Americans do support organ donation, yet only 40% have actually taken the necessary steps to get registered. Don't be a part of the 55% of Americans who haven't made their place on the donor registry a priority. Become a potential organ donor. It's as simple as filling out an organ donor card when you renew your driver's license or registering with your state's donor registry. If you'd like to become a living donor, which means volunteering to donate the organs you can live without, you should work directly with a family member or friend's transplant team for whom you'd like to donate, or contact a transplant center to see if anyone in your area needs an organ. Don't let anything get in the way of potentially saving the lives of as many as 8 people. You have the opportunity to have a meaningful impact on someone's life even after yours has ended. The shortage of available organs for transplant has become increasingly apparent as more lives have continued to be lost. People keep waiting for a complete stranger to make the decision to add their name to the donor registry and save their lives. Even though many Americans have already registered, the impact is still not enough to decrease the death rate of patients waiting for transplants. Registering is a simple process, which could result in extending the life of someone else should yours be unable to continue. The United Network for Organ Sharing has a quote that says, "Without the organ donor, there is no story, no hope, no transplant. But when there is an organ donor, life springs from death, sorrow turns to hope, and a terrible loss becomes a gift." Do your part to give another person a story with a happy ending, and register as a potential organ donor.